in the level ward unit of a teaching hospital. I was the most senior specialist on call. A woman was rushed in. She was screaming in pain, and behind her was her mother, who came with her. The mother rushed to a call room where we all stay and beckoned on us to come. I came out and she said, "Please help my daughter." She was booked for a cesarean delivery and she declined. Rather, she went to a maternity home to try labor. The mother had arrived from Asaba that morning and met her in a maternity home and quickly moved her to the teaching hospital. Mrs. A was a 34-year-old woman. She had been married for 7 years without conceiving. She had had 2 surgeries to remove fibroid masses from her womb. Following these surgeries, she now got pregnant. And in the course of her antenatal care, she was advised that it would be best she delivers via cesarean section. She vehemently denied. It was not her portion. That she was going to deliver like the Hebrew women. She quickly ran to a maternity home that assured her she was going to deliver. Luckily for her, her mother came. Her mother came at the very right time and brought her to the teaching hospital. We rushed into the theater. When we opened her up, her womb was already giving way. She was minutes, maybe hours away from rupturing her womb and probably bleeding torrentially to death and losing her baby as well. It would have been a wasted effort. All the pains, she would have lost her baby and lost her life. But thank God her mother came. Thank God her mother appeared just at the right time. Maternal health is the health of a woman while she's pregnant, during delivery, and after delivery. We ensure that as much as possible that pregnant women have a very positive experience throughout this period. Positive experience that will ensure the well-being of herself and her baby. Maternal death or maternal mortality is the loss of a woman during pregnancy, delivery, or within 42 days of delivery from causes related to pregnancy. And it will shock us that 810 women die globally, daily, from pregnancy-related causes. And 94% of these women that die daily die in the low-income countries, like Nigeria. We have an alarming rate of maternal mortality. Out of 100,000 deliveries, we lose 814 women to childbirth. This is compared to less than 70 in the developed countries. When a woman is pregnant, the probability of her losing her life in Nigeria is 1 in 22. Meanwhile, if a woman is in UK or in US, the probability is 1 in 5,000. So So we have an abysmal record of maternal deaths in our country, even in Southeast. About 5.3 million children died in 2018 alone before the age of 5. And 43% of them died in the first 1 month of life. That's the period called the neonatal period. We have very high neonatal mortality rates in Nigeria, as large as 43.5% compared to less than 10% in the Western world. Perinatal mortality rate, that's the number of children that die within the first week of life, is as high as 129 per 1,000 births. It's shocking. It's alarming. The causes of both maternal and child death could range from direct causes or indirect causes. When we say direct causes, we mean causes directly relating to pregnancy. Top on the list is bleeding in pregnancy. The story I just told you, if not for the intervention of her mother, she was going to bleed to death. Secondly, on our list is hypertensive diseases in pregnancy, preeclampsia and eclampsia. In layman's word, convulsions in pregnancy as a result of hypertension. Again, infections in pregnancy that leads to sepsis. Then abortions and their complications. These are the major causes of maternal mortality, and they are direct causes. Now, linked closely to child death. If a woman bleeds, most likely she will have an asphyxiated baby. Asphyxia, difficulty in breathing and maintaining breathing, is the major cause of the leading cause of death in children. If a woman has hypertensive disease in pregnancy, she's going to have an asphyxiated baby. If a woman has infection in pregnancy, she's going to give birth to an infected child who will have sepsis too. So you see that maternal health and child health are linked together. Now, some of the shocking things we see, and we term the indirect causes of maternal mortality, maternal deaths, are cultural practices, belief systems, religious inclinations, myths, norms handed over to us from our forefathers, and we tenaciously hold on to them. And prophets tell us, you will deliver like the Hebrew woman. And we hold on to them. We need to begin to challenge some of these cultures and some of these beliefs, some of these religious inclinations, so that we can improve the indices for our mothers and our children. A lot of cultural inclinations are there. However, recall that in this story I told you, a mother came to save her daughter's life. That was culture. A culture that is indigenous in our people. A culture that we've embraced over the years. The mother came. The Omugwo culture. There are also cultures we have that can improve maternal and child health. Motherhood is a very thrilling experience with mixed emotions, ranging from fear, joy, excitement, sometimes sadness, cries. And we must ensure that any woman who is going into pregnancy, childbirth, and motherhood has a positive experience, has a support system that will guide her through this process. And our ancestors, in their wisdom, developed a practice, a concept that is called the Omugwo concept, the Omugwo practice. The Omugwo practice is a rich indigenous practice among the Igbos, and over the years it has spread to involve other cultures, other tribes in Nigeria. In the north, I was shocked to know that while an Hausa woman delivers, or a Fulani woman delivers, she is meant to go to her mother's place and spend 3 months. The Yorubas too, the woman's mother comes, spends a month, while her mother-in-law comes and spends 3 months. But in Igbo land, our own Omugwo culture, the mother of the woman comes around, traditionally before her due date of delivery, and helps her through the process, helps her through labor, helps her to take critical decisions for labor and delivery. Mrs. A that we described, her mother had come before her delivery and was able to take a critical decision to bring her daughter to the hospital to salvage her life. There are lots of benefits of Omugwo, and I'll divide it into pre-delivery, delivery, and postnatal. Pre-delivery, I'll re-emphasize again, decision-making. Decision-making. One of the delays that lead to maternal mortality in Nigeria is what we call a type 1 delay. A delay in taking a decision to move to a health facility. And when we have a good support system, when we have an experienced mother who knows when contractions start, who knows the signs of labor and advises you, let's move to the hospital, it's a pause. It removes the type 1 delay for us and helps us to start interventions early. During delivery, there's a system WHO developed that they call positive pregnancy experience. In positive pregnancy, one of the components is support during delivery. Studies have shown that women that have their close relatives sitting or staying with them in the labor ward do better, have higher chances of having vaginal delivery than cesarean delivery. You can imagine your mother close to you in the delivery room, holding your hands. For the very religious ones, compassion. Okay, telling you, I did this, you can do it. I went through this 7 times, this is your first, you can do it. Imagine the encouragement. Imagine the adrenaline that will be flowing through your head. I cannot disappoint my mother. And you stay on and stay true to it. That support system is one of the major benefits Omugwo gives to us. Immediately after delivery, we advocate that children be put to breast immediately. The frustration women have trying to put their children, especially first mothers, how to sit down, how to position your hand, how to latch the baby on the breast, can be frustrating. And when you have your mother, a close person around, she will teach you. And once you get it right, you feel on top of the world that the baby is suckling your breast. And that particular activity causes increase in breast milk flow. Whether the milk is flowing or not at that moment is immaterial. As long as the child suckles on that breast milk will flow. When these babies now go home, that is when you enjoy the most of the Omugwo. all manner of food. I started adding weight when I had my first baby. The things my mother-in-law came with, I wake up in the morning with myriad loaded with all manner of proteins. That nutrition, that food, the pepper soup, all those things help the woman to rejuvenate, to recover, helps her to rehydrate, and improves breast milk flow. The importance cannot be overemphasized. And do you know what it means that you just gave birth to a child and your mother is there carrying your child and you're crossing your legs somewhere watching Z World and Telemundo? It helps you to recover from the stress of pregnancy. One of the things we have to deal with post-delivery is depression, maternal blues, depression, puerperal psychosis. You would think it's a joke. A woman is left alone. She has to sweep the house herself. She has to clean everywhere. She has to feed the child. The child is crying. She's going nuts. Before you know it, she's complaining. She's feeling worthless. She tips into depression, tips into full-blown psychosis. And it's also a cause of maternal mortality. There are other things the mothers can help do. These experienced mothers will know when a child is sick. Wait, this is jaundice. Wait, this is this. Let's go to the hospital. They will help go for immunizations and everything. While we praise Omugwo, we have had gory stories from Omugwo. Annoying stories. First, there are things we need to debunk. The first milk that comes from a mother, please, is not apple. That milk is called colostrum and is rich in proteins, rich in antibodies, rich in nutrients. The babies need it. And what we hear in the labor wards are amazing. That babies should not take that, and you see a woman not breastfeeding. Those are the parts of Omugwo we need to set aside. Then, once you see a woman deliver, you see the father of the lady rushing with a gallon of palm wine. Please, a gallon of palm wine will not help breast milk flow. Please, rather, you make the woman high. And while the baby is suckling, the baby can as well get high. There are lots of other things. When a baby is sick, instead of seeking care, you hear people say, "Apia, on ta, on lacha, or jedi jedi," and they give all manner of concussions. Those things will have to be set aside. If we must improve our maternal and child indices, we have to advocate for the right Omugwo practices. How do we get these things done? What I'm about to say are my personal opinions and personal suggestions. While the federal government have given paternity leave, I think we should start giving Omugwo leaves, so that a mother whose daughter is about to deliver can be freed to go and become a pillar to her daughter. I also think we need to increase advocacy and education on the proper Omugwo practice. We need to go into the villages, we need to go into the marketplaces. We need to tell them the real things, what should be done and what should not be done. I'll end with another story. A woman had a set of twins, normal delivery, and they were sent home. Of course, the mother came for Omugwo. If you've ever followed new babies, you know that there is an umbilical stump that is left, and you have to care for that stump. The mother of this lady, every morning, will mix toothpaste and candle wax and apply on the umbilical stump. About a week later, this child developed fever. These children rather developed fever. They were a set of twins and started convulsing. They lost one of the twins, and the other spent 1 month in the hospital. These are the wrong Omugwo practices. We should jettison and stick to the right ones. Thank you very much.